Hello guys. In this lecture we will be discussing about a question which is being asked many times on different forums on the internet and probably it may come in your board exam. It is about a situation where in the developing dental occlusion when the child is like maybe 7 year, 8 year old and their molar relationship is going in towards the class 2. So what can happen? First of all, let's see what are the possible relationships of the deciduous molars and the first permanent molars in the developing occlusion. The primary dentition usually is being completed by about 2.5 years of age. It erupts in a more upright position as compared to the permanent dentition, and the overjet in primary dentition is slightly more than 2 millimeters but less than almost 4 millimeter when the child is growing normally. And the average overbite is 2.5 millimeter. Molars in the primary occlusion, they can have one of the three situations, three possibilities. And what are those? The most frequent among the children, that is the mesial step. Between the distal surfaces of the second molars, second primary molars, it corresponds to the class 1 molar relationship in adult dentition. Just like this is the first permanent molar, and these are the deciduous molars, these are the second deciduous molars, upper and lower, and almost they look like as if the class 1 molar relationship of the permanent dentition. Then we call it mesial step. Then we have flush terminal plane, where the distal surfaces, they are in a straight line, and molars, the first permanent molars, would be in an end-to-end relationship. Then comes the distal step, which we call corresponds to the class 2 molar relationship of adult dentition, the disto-occlusion type of pattern. So this is the upper and lower deciduous molars, and over here we can see the first permanent molars. Now, this is the question which is being asked multiple times. A young child with early mixed dentition has a molar class 2 relationship. As the child will grow, this type of occlusion will, option A, develop into a class 1 molar relationship as the primary molars will exfoliate, or it will get worse due to further growth of the maxilla, or will it develop into a class 1 molar relationship with the mandibular growth, or it will develop into a skeletal malocclusion with the passage of time as the child will grow, or is not going to be changed as both the jaws will grow. So let's analyze the question. What happens in the mesial step? Over here we can see these arrows. So if there will be in the mesial step, which is corresponding to the class 1 molar relationship, the blue arrow, if there is minimal growth differential, it will stay like this, or it may become class 3. So a child with early mandibular growth may have a mesial step relationship in the primary molars, producing a class 1 molar relationship at an early age. It is quite possible for this relationship to progress to a half cusp class 3 during the molar transition and proceed further to a full class 3 relationship with the continued mandibular growth. If the differential mandibular growth no longer occurs, the mesial step relationship at an early age may simply will become a class 1 molar relationship as the child is going to grow. Now what happens in the flush terminal plane? Again, this red one is the forward growth of mandible, this blue one is the minimal growth differential, and this is the shift of teeth, the green dotted line, the dotted arrow. As we know that when there will be flush terminal plane of the deciduous molars, so there will be an end-to-end relationship of the permanent molars. In a flush terminal plane relationship, an end-to-end relationship of the permanent molars is produced when they first erupt. It can change to class 1 in the permanent dentition like this, but it can remain end-to-end in the permanent dentition if the growth pattern is not favorable. What happens in the distal step? In a distal step relationship, it may change during the transition to an end-to-end one half cusp class 2 relationship in the permanent dentition. But remember, it is not likely to be corrected all the way to class 1. It is stated by Moyers, and reference is also given, the Moyers reference is also given in the profit. It also is possible that there will be little or no any differential forward growth of the mandible. In that case, the molars in the permanent dentition will most probably remain in a full cusp class 2 relationship. Here we can see if there is minimal growth potential. So what is going to happen? They will be ending like half a cusp 2, class 2, or they may they will become the full cusp class 2, like not half, full cusp class 2. And in case if the mandible is growing, so it will become an end-to-end or half a cusp class 2. So there is no chance that without any intervention with the interceptive orthodontics, you may convert, like it is going to be spontaneously converted into class 1. It will remain like that. For that, to convert it into class 1 occlusion, you have to look at the situation, and then if the myofunctional appliances would be given or interceptive orthodontics is going to be initiated, then only it will be. But without intervention, it is not possible. So the answer will be a young child with early mixed dentition has a molar relationship. As the child will grow, this type of occlusion will not change as both the jaws will grow. So over here we are done with this question and its analysis and the answer, and I will get back to you soon with more questions, more queries which are coming from you, and I will bring more interesting videos for you. Till then, thank you very much.